Hi guys, my name is Trisha Lind and I am talking about the Barlow and Ortolani tests. Okay, let's talk about why we perform these exams. The Barlow and Ortolani exams are performed on infants in the first few months. After the first few months, they're not as reliable, so we use other exams such as looking at the different lengths of the legs or the hips and how even they are. These tests are for finding developmental dysplasia of the hips, including instability, laxity, and dislocation. 1.5 to 25% of newborns in every 1,000 births will have hip dysplasia. We can also use ultrasound if we have a high suspicion, and the American Academy of Pediatrics recommends an ultrasound in all females who are born breech. Early identification of hip dysplasia is important as it can have long-term consequences if not treated. What are some predispositions for hip dysplasia? Hip dysplasia is more common in girls, babies born breech, babies that have a high birth weight, low amniotic fluid, and a family history of hip dysplasia. We also want to talk with parents about swaddling, as swaddling tightly with legs straight can increase the risk. Hip dysplasia can include a shallow socket with a loose hip, an unstable hip where the femur can dislocate easily, or a hip that is completely out of the socket. In hip dysplasia, the femoral head and socket do not fit tightly together, which can lead to abnormal growth. Okay, let's talk about the hip anatomy. So you can see the acetabulum, which is the socket of the hip, and then you can see the femoral head and how it fits nicely in this groove, and then the ligaments surround this. There's also a joint capsule and cartilage. And then you can see on the bottom how this is a little more shallow, and so it allows the femoral head to easily slip out of the acetabulum or socket. Okay, let's talk about the Barlow and Ortolani exams. The Barlow maneuver is first. You're going to have an unclothed infant lying on their back. You're going to flex the legs at 90 degrees and adduct towards the midline. And you're going to push down with gentle pressure, and if this exam is positive, the femur will pop out of the socket. The Ortolani maneuver is the reverse of the Barlow and reduces the dislocated hip back into the socket. This is done by abduction and applying gentle pressure over the posterior hip, lifting the femoral head back into the socket. A clunk should be felt if positive, and sometimes a click can be heard. Okay, so I didn't really have a baby to show these exams, so I read an article where they use chicken, and you want to have a free-range chicken so that they have a good groove. And so what you're going to do is cut into the chicken to find the hip socket, and then you're going to perform the maneuver where you go into the midline with the hips and press down, and this will dislocate the hip, and then you're going to go out and press up, and it will bring the hip back into the socket. So I encourage you to try this at home just to kind of get that motion of the hip coming in and out, and you can feel the clunking, and it's kind of cool, and you can eat the chicken after. So thanks for watching. So treatment of hip dysplasia is pretty simple. If you do find that a baby could have hip dysplasia, you want to refer to an orthopedist, and what they'll do is possibly put them in a Pavlak harness. The earlier they start, the better. The harness is worn 24 hours a day for 3 to 6 weeks. They take off for baths. And if the infant doesn't improve, sometimes they need surgery. Sometimes they'll just wait and the instability will resolve on its own in 6 to 8 weeks without treatment. And here are my references. I have that article that talks about using the chicken hips as a way to teach the exam. So if you want to check that out, there's a link below.